ಅಪಾಲೋ ಸೀನಿಯರ್ಸ್ ಫಸ್ಟ್ ಎಕ್ಸ್ಪರ್ಟ್ ಜೆರಿಯಾಟ್ರಿಕ್ ಕೇರ್ ಉದ್ಘಾಟನೆಗಾಗಿ ಪತ್ರಿಕಾಗೋಷ್ಠಿಯನ್ನು ರೆಸಿಡೆನ್ಸಿ ರಸ್ತೆಯ ಚಾನ್ಸರಿ ಪೆವಿಲಿಯನ್ನಲ್ಲಿ ಆಯೋಜಿಸಲಾಗಿತ್ತು. ಈ ಪತ್ರಿಕಾಗೋಷ್ಠಿಯಲ್ಲಿ ಡಾಕ್ಟರ್ ಸ್ಟೀವ್ ಪಾಲ್ ಮಂಜಲಿ, ಹಿರಿಯ ಸಲಹೆಗಾರ, ಜೆರಿಯಾಟ್ರಿಕ್ ಮೆಡಿಸಿನ್, ಅಪಾಲೋ ಆಸ್ಪತ್ರೆಗಳು, ಶ್ರೀ ಅಕ್ಷಯ್ ಆಲಿಟಿ, ಸಿಇಒ, ಅಪಾಲೋ ಆಸ್ಪತ್ರೆಗಳು, ಶ್ರೀ ಉದಯ್ ದಾವ್ಡಾ, ಅಪಾಲೋ ಆಸ್ಪತ್ರೆ, ಶೇಷಾದ್ರಿಪುರಂ, ಗೋವಿಂದಯ್ಯ ಯತೀಶ್, ಅಪಾಲೋ ಸ್ಪೆಷಾಲಿಟಿ ಆಸ್ಪತ್ರೆ, ಜಯನಗರ್, ಶ್ರೀ ವಿವೇಕ್ ಕುಮಾರ್ ಮಿಶ್ರಾ, ಅಪಾಲೋ ಆಸ್ಪತ್ರೆಗಳು, ಸರ್ಜಾಪುರ ರಸ್ತೆ ಉಪಸ್ಥಿತರಿದ್ದರು.
I'm Dr. Steve Paul, Senior Consultant Geriatrician at Apollo Hospitals, Banargata, Sheshadripuram, and now at Sarjapur. What we aim to achieve through Seniors First is enhanced care, seamless care across all zones. When you talk about geriatric care, the care is not restricted to hospitals. It starts at often as an outpatient visit, sometimes needing hospital care, post-hospital care, and at home too. So this continuity of care is where we aim to be different compared to other geriatric care services. And this coordination is only possible through a dedicated team and a dedicated health manager who will liaise with the patient and with the doctors such that unnecessary hospital visits and hospitalizations can be avoided. Because one of the strongest predictor for in-hospital complications is delayed care. Patients, especially when it comes to older care, take a lot of time and a lot of thought before visiting the doctor. Unfortunately, by the time they decide to seek the doctor's help, care is often complicated. The need to go to a doctor and to address their health needs is markedly delayed when it is compared to child care. So like how we have specialized child care, pediatrics all across the globe, geriatrics is such a specialty that needs more attention. As I've mentioned, it may be difficult to get geriatricians everywhere, but it is important to talk about geriatrics so that the need rises. When we started off geriatrics in India, it was towards the late 1980s or 90s, whereas in the West, UK, Australia, geriatrics had started much earlier. So we, in that aspect, are a relatively newer generation. But when it comes to geriatric care, we also need to focus on home care. Not all hospitals, not all older persons like to come to hospital. Most of them hate hospitals. But when it comes to hospital care, we can provide hospital care to a reasonable extent at home. This is, I have to emphasize, different from palliative care. Palliative care is comfort care, keeping the patient at home, often at the cost of providing the best care. So when you talk about geriatric care, it's about improving functionality. How independent his or her mother was 1 week back, to get him or her to that extent, to that level of functionality, is what geriatrics aims to achieve. And this is not possible by 1, 2 or 3 physicians or geriatricians. It's only possible when we as a team start to think and talk about elderly.
Thank you.